which is a partner, of Chicago Hyde Park Village. And we have been having a wonderful partnership with you. You're an active group, and we always love being able to come and do education with you and learn from you as well. So when I was asked to give this talk today, as you can see, the title says Boosting Your Brain Health at, and that SSSC is South Shore Senior Center. And I think many individuals on the call here are patients at South Shore, or you have friends who come to South Shore Senior Center. But this is a talk that I think is relevant to Chicago Hyde Park Village because you are active and vibrant older adults who are really trying to set the stage for what it means to be civically engaged in the Hyde Park community. And this talk is really about how individuals who consider themselves seasoned or older can improve their overall brain health. So that's my introduction. Okay. So I'm going to start with the slides, but before I start, I am very laid back. I can't see everyone on the screen if you have questions, but if there's a question that pops up, Lucas, please feel free to stop me, and I'm more than happy to elaborate on anything that you have questions about. So should we get started?
Yep, sounds good. Perfect.
All right. So today's outline, we are going to focus on brain basics, get a little bit of education about the brain and what it does, learn a little bit about how the brain changes as we age. We're going to talk a little bit about the definition of brain health and how we can get some of that. And we're also going to talk a little bit about what are some risk factors to brain health and decline in our overall cognitive function. And we're going to review a study that focused primarily on brain health, the US Pointer study, and sort of review what they found in that study and how it applies to all of us. And I'm going to ask everybody on this call to make a commitment to their brain health as a result of participating. And I know everybody's doing this virtually, but I sent Lucas my slides as well as a handout that you can print out at home and utilize this handout to be able to jot down a little bit about your objectives for your overall brain health. So Lucas, I'm completely fine with you sharing the slides as well as that handout with everyone. And sometime today after the call, I'm hoping that everyone will print out that commitment to their brain health and fill it out and come up with some ideas about how you can improve your overall brain health. So that's our outline for today. So when we think about the brain is a wonderful, marvelous muscle in our body. And I call it a muscle because it needs to be exercised just like your biceps, your triceps, every other muscle in your body. The brain requires exercise, and the brain is able to grow and it's also able to shrink just like any other muscle. So the brain weighs about 3 pounds. And the brain uses about 20% of the overall energy in your body to function. So that means when we're not in good states of health, when we're dehydrated, or if we've got a urinary tract infection, or if we've had a heart attack, all of those medical conditions, because they require more energy from the body, they still energy from the brain. And that's why people oftentimes will get more confused when they're in the setting of a new illness or what we call an acute illness. About 86 billion neurons, those are small little tiny nerve cells in our body that connect and communicate with each other, encompass our brain matter. And what does that brain matter do? It's responsible for how we love, how we do our taxes. Our brains help us to walk around, to talk and communicate with others, to dance, and to read. And why is it so important to know about those connections? Sometimes those connections are interrupted. If we have a stroke or if we are dehydrated, that in some way can diminish or limit those connections of those nerve cells. And why is that important to know? Because most people think, oh, if I have a stroke or oh, if I'm dehydrated and I'm having less cognitive function, that means that the decline is there forever. But that's not true. We have something called neuroplasticity, which means that our brains can rewire those connections and improve our connections and our cognitive function, whether we're 69, 99, or 109. Those neural connections can still be improved. Any questions so far? Please unmute if you have any. Okay. So if we go to the next slide, this is just an overall slide of the brain and all of the different lobes of the brain and what those different lobes are responsible for. So if we think about the parietal lobe is our center for sensation and feelings and perceptions, and even our overall awareness of our body. So if someone has a stroke in this area, they sometimes will have potential for loss of ability to recognize a side of their body, or they may have difficulty with depth perception or perception of what's close to them or far away from them. Our occipital lobe is responsible for our vision and our, perception of how far or how close something is. Our brain center for language is Wernicke's area and our ability to sort of understand language and communicate it. Our cerebellum takes care of our balance and posture and lets us know what position our body is in and how coordinated we can be with our walking and mobility. Our brainstem sort of controls our level of consciousness and even our breathing and heart rate. So oftentimes when people have brain strokes there, that might be something that's life altering. People can't live if they're not able to breathe on their own. Or if someone has a stroke in the temporal lobe, that might impact their hearing or language or memory. The Broca's area is another one of our speech areas right here behind the frontal lobe. And our frontal lobe is primarily responsible for our inhibitions. So, our ability to control our behaviors and our personality is in our frontal lobe. Even our ability to problem solve and do our taxes and keep a budget are all controlled there in that frontal lobe. And then our sensory lobe is primarily here, looking at our ability to sense different sensations and temperatures. And then our motor cortex is right here. So you can see our brains are complex machines that control every single aspect of our cognition, which is not just about memory. Cognition is also about our language skills or our ability to do our executive function, higher level plan and process, and even our ability to feel and show emotions and see and hear. So that's our brain. So, what is normal as we age with our brain? Before I go through this slide, can one or two people just unmute themselves and tell me what's normal in aging? What do they think is normal? Can't go on until at least one person.
Balance is impaired somewhat.
Okay. And you're right. We do tend to have subtle changes in blood flow to certain areas like the cerebellum, but a big reason why balance may be off is perception can change somewhat as we age. So our depth perception can definitely impact our balance. That's a great one.
What
Anything
about
else?
We're a little more forgetful.
We
Or
can sometimes have slower processing of information, which makes it a little bit harder for us to come up with the word we want or the information we want at that time. But it usually catches up to us later,
Mhm.
like when we're
forgetting a
lying
word,
down in bed.
Yes.
or
Yeah.
forgetting a word and can't, I mean, you know the word, but you can't,
Yes.
doesn't
Yes.
come to you.
Yeah, it's retrieval. It's called retrieval. So we actually learn that word. We know it. It's ingrained in our brain, but it won't come up at the right time.
Mhm.
So we have a problem with retrieval sometimes as we age. But we're going to recall it later. We just have to be patient with ourselves. We can't sit there and go, that noggin or dummy, that doesn't help.
What about when
Mm.
somebody is talking and they seem to be going so fast that your brain is not getting what they're saying?
That's hearing, isn't it?
Yes, Susan. So I think sometimes they are talking too fast, or sometimes it may be you have to give yourself a little grace and just slow down and try to pick up the nuggets, like one or two words that are important that put the whole puzzle together. I agree. Susan, you had something else?
Oh, strength.
Yeah, strength
Strength.
can be very different because as we age, our muscle mass oftentimes declines somewhat. So definitely our muscle strength, our axial skeletal muscle strength can decline somewhat. But thank God the muscle strength up here in that brain, because of neuroplasticity, can actually improve as long as we're doing all of the brain health activities to keep it improving. You guys answered everything I put there. Slower processing, possible less cognitive flexibility. So we got to do one thing at a time, not multiple things at one time. The forgetfulness, but you're going to recall it later. So just give yourself grace. And then remember that lifestyle can protect and improve your brain health. You
Is
do
there
not have to stay where you are right now. Yes.
is there a difference in retrieval of people's names versus words versus not recognizing where you are?
So, retrieval of names is very common if they are people that are not familiar to you, they're acquaintances. But if it's a close family member, that really shouldn't be happening unless you are a parent of three or four kids and you're like, which one of you is it? So that's pretty common. Um, Trying to recall new information also is going to be a little harder because that processing of new information is a little slower. So, really just giving yourself grace. I think concern should be raised when someone is forgetting information and they're not recalling later, and especially if it's critical new information. You just had a motor vehicle accident, or you just got a check and you're not sure if you got the check. You can't remember that you got it the other day, or you have an appointment and just totally blew your mind. You forgot about it and you don't recall later to, go reschedule that appointment. Those might be different prompts for concern that might mean, hey, it's time to go for a checkup with the doctor and get some blood work, look at your meds, and see if additional brain health testing needs to occur. But for the purpose of this talk, we're talking about individuals with normal aging changes in the brain and how can we protect and improve overall brain health. So great questions. So what is brain health? Well, brain health refers to how well a person's brain functions across several areas. I sometimes call them areas, I sometimes call them different domains of cognitive health. So one big area is your overall cognitive health. How well are we thinking? How well are we learning information that's new and old? How well do we remember new information and old information? Our motor function is also a part of our brain health. How well are we able to move and balance and prevent ourselves from having falls
Yeah.
and make sure that we're coordinated with our movements? Our emotional function is a part of our brain health. How well can we handle our emotions and stress? Are we more irritable? Are we more anxious and agitated? Are we impulsive? Are we not thinking first before we act? And then even our sensory function is a part of our overall brain health. How well do we see what's going on in our environment? How well can we feel and touch? You know, you can imagine if someone's having difficulty with decreased sensation in their feet as they ambulate, that's a sensory deficit that really puts you at risk for falls, which puts you at risk for decline in your motor function and cognitive health. And how well can you interact with that environment safely without it being an issue? We want our overall brain functions to be able to help us function as independently as possible and to optimize our quality of health day in and day out. Any questions about this definition for brain health? So, why is brain health important? These are just a few reasons that I can think of, but I'm sure many of you will have others to contribute. I always think of it as it's a way to prevent a stroke, prevent Alzheimer's, prevent other forms of cognitive decline. Improving your brain health is a way to boost your focus, your emotional balance, your productivity, your daily function. It's also a way to keep up with brain protection overall so that you can live as long as possible. And it optimizes your independence in the community. What else would brain health mean to anyone else on this call? Can you name a few things that I should be putting on this slide? And I'm writing it down right now as you're saying it. No one?
Joy in life.
Ah, I love it. I love it. To enhance your joy. Love it. Anything else that I forgot to put on here?
Well, happy active engagement and being involved. And that goes for everyone who's on this call as a part of
Active
the village.
engagement.
And volunteering, helping. We're neighbors helping neighbors. And so the whole volunteerism is a real important part of, I think,
Yes.
aging and being healthy.
Yes, I love it, Susan. And I want you to elaborate on that in one of the later slides that sort of talks about how important social engagement is to brain health. Love it. Anything else before we go to the next slide? Am I going too fast, guys, or too slow? Or okay.
Good.
Okay, cool. So, what are different domains of brain health that we should really and truly be thinking about? The first domain is physical exercise. It has to be a part of brain health, or else you've lost your brain health. And a lot of people think of physical exercise as doing a marathon or going to the pool every morning and doing 10 laps. That is not just the component of brain exercise of physical exercise. Physical exercise can be about taking a walk, or it can be about doing Tai Chi to enhance your balance, or doing yoga to enhance your balance. So don't always think, I can't do this or that. Figure out who you are, what you love that moves your body, and that's your physical exercise. Nutrition is also a big part of brain health. Mental stimulation, quality sleep, social engagement, having those interactions, because in every interaction, that's another way to find purpose for life. And people who live without purpose are not living. And then stress management is another big part of brain health. So all six of these domains I'm going to go through in the next few slides. The big thing I want you to think about before we get there through the next slides is, what can I modify to optimize my brain health? So we know that these 12 areas are areas that you can do work on in your day-to-day life that will help to optimize your brain health. So if you have less education, you don't have to go get a PhD, but you might become someone who's doing reading or doing online education. If you have hypertension, work with your doctors to try to come up with a plan to lower it. And it doesn't always include medication. It might be changing your diet or incorporating exercise. Correcting hearing impairment. Individuals who experience hearing impairment that is untreated increase their risk for dementia fourfold. So untreated hearing impairment can directly lead to dementia. So it is important to work with your doctors on a plan for hearing impairment. Make sure you don't have wax buildup. Make sure that you talk about whether or not a hearing aid is appropriate, whether or not a cochlear implant is appropriate, whether or not a pocket talker is appropriate. Pocket talkers are little devices that look the size of a cell phone, and you put headphones in them, put the headphones on, and then people talk into the microphone and you're able to hear better. You can even use it for the television, and they cost $200 as opposed to $5,000 for hearing aids. Smoking cessation, optimizing your weight to below an overweight BMI is important. Treating depression, getting physically active, controlling the diabetes, talking with your doctor about what are my numbers, what is my A1C, which is an indicator of how well controlled your blood sugars have been the past 2 months. For an older adult, we usually shoot for less than 8%. So if you're not there, talking to your doctor about how to get less than 8%. Improving your social contacts, making sure that you're spending time with family and friends and volunteering and going to the library, starting an art class, limiting your alcohol consumption. I love a glass of wine with dinner every once in a while. I'm 57 now, but when I'm 77 or 87, my body may not be able to tolerate that as well. So, really and truly asking yourself, what has to change as a result of aging so that I can have the best quality of life? Avoiding a traumatic brain injury. Falls oftentimes end in brain trauma. So you can avoid that by doing exercises and working with physical therapy to make sure you don't have a fall. And then avoiding air pollution, maybe considering an air purifier in your home, or maybe considering not driving so you're not exposed to fumes. Any questions so far? So how can I improve my brain health? So let's go
Oh,
through some of
excuse
those.
me. I had a question. Do Zoom conversations and meetings count as social contact?
They do, Miss Ellie, they do, but you want a combination of this type of interaction along with some in-person interactions.
Uh-huh.
But as we learned in COVID, the people who completely isolated and, had no social stimulation outside of their homes declined pretty rapidly. I'm sure you all saw it with friends. I saw it with loved ones. But people who have a mixture of social engagements, whether it's doing a Zoom call for fun or doing a Zoom education or going to a community center or going to a volunteer program like Chicago Hyde Park Village, these are all different modes of social interaction in addition to family and friends. Okay? So, how can I improve my brain health?
Wait a second. What about people talking on the telephone? I mean, you call up and you have a chat with your friend.
Yes.
I see
Yeah,
them.
that definitely counts. That definitely counts. But irrespective of Zoom calls and um, meetings that you have on Zoom and telephone calls, nothing outbeats social interaction, face to face, being able to touch and interact with someone. So that should also be incorporated. Okay. So if we go through some of these brain health domains, a big one is physical activity. We found that physical activity reduces the risk of stroke as well as dementia, in addition to heart disease and everything else. We found that the perfect amount of exercise in older adults is about 30 minutes, 5 times weekly of moderate activity. Moderate activity is activity that gets you to a point where you can do a little sweating and you feel your heart rate going up a little. Okay. So that can be anything from walking to gardening to stretching to yoga, to Tai Chi, anything that gets your body moving, 30 minutes a day. And I purposely put here 30 minutes a day because this is 30 minutes a day, 5 times a week of moderate activity to help improve your overall health. But activity should also incorporate other forms. It shouldn't all be aerobic or anaerobic. It should also be balance exercises like yoga and Tai Chi and stretching. And it should also be strength focused exercises like lifting weights. How many of you all have used cans of soup as weights? Yeah, during the pandemic, I actually did. I would sometimes even get things like uh, bottled waters, like the big ones, the 64 and 32 ounces to use as weights because I didn't have weights at home. So, those are simple things you can use as weights to build muscle. And then who knows about Sit and Be Fit on YouTube? It's a free platform for senior exercise where you can sit in a chair and do aerobic exercise. And it's a great site. So all you do is go to YouTube and then in the search box, you put in Sit and Be Fit. In addition to Sit and Be Fit, there are these great videos that are free for Tai Chi. Tai Chi is one of the clinically proven exercises to improve balance in older adults. I've already started doing it. I love it. And it looks so graceful. I can't wait until I get really good at it. But just go to YouTube, you put in the search box free Tai Chi online, and you'll see all of these different videos come up. Any questions yet? So we talked about physical activity being one of the domains for brain health. Eat for life, your nutrition impacts your brain health. So foods that we should be loving on are things like berries, leafy vegetables, olive oil, fish, nuts. These different foods are the proponents of a diet called the MIND diet. And the MIND diet was studied at Rush University. I think they did the study like 15 years ago. They looked at over 2,000 individuals over the age of 60 to put them on this diet and determine how it would impact their overall brain health. And most of the people in the study were either normal cognition or they had a family member who was at risk for dementia. And what they found was the people that were on the study over a 2-year interval improved in their overall brain health, and they staved off dementia diagnosis. It was able to stave it off. So it's really important what we put into our bodies. It impacts how healthy our brains function. We should limit foods like sugar, fried foods, processed snacks. We should increase the fluid intake in our body, in particular water. So we should get about 60 ounces per day of fluids at least. And a lot of people tell me they hate the taste of water. So why not get your favorite fruit and cut up slices of your favorite fruit and put it in your water to flavor it? Limit soda, limit coffee and alcohol, and avoid fast foods. They lead to heart disease, liver disease, brain disease, and diabetes. I'm not saying you will never have your favorite fast food again, but maybe limit it to once a week as opposed to daily. Okay. Um, that diet I talked about, the MIND diet, is a combination of the Mediterranean diet and the low sodium DASH diet, which many doctors recommend for people who have hypertension. And remember, the findings of the MIND diet study were that it reduces the risk for dementia development. The participants in that study, again, were older adults with a family member at risk for dementia. They were overweight and unhealthy. And the intervention was half of the people were on the MIND diet and half were on a control diet. And over that 3-year period, they found that improved cognitive functioning in those people on the MIND diet, and they had stable brain imaging, so no new strokes. Okay. So just what you eat can impact your risk for dementia. What about mental stimulation? That was one of the domains that we said helps with brain health. So mental stimulation can be anything from gaining a new brain connection with a challenging hobby or an activity like line dancing. How many of you guys go dancing? No one?
I would
I
love to go line dancing, but where does one go?
Oh my God. Okay, so I went line dancing. Do you know where our South Shore Senior Center is?
No.
Okay, do you know where the cultural center is on
Yeah,
71st and Exchange?
yeah.
So right behind the cultural center, they have a little path. If you park in parking lot A, there's a little path that leads towards the beachfront. There's a restaurant there and a paved dance floor. And they have free line dancing every Monday from 6 to 8 p.m. It was so much fun. I was so bad. I have two left feet. So I was horrible, but it was so much fun. And it's something I hadn't done in like years. So think about doing something like that or go to the movies in the park. They have free movies in the park every Tuesday at different locations throughout the city. Or maybe even going to some of the concerts down at Millennium Park every Saturday and Sunday for free, or going to the museum in the morning for the walking program. There's so many different activities that you may not have known about in Chicago that if you pick one new activity a week, those are new brain connections that you're making. Um, Learn Spanish online or take up a new instrument or start playing cards, or how many of you guys play Mahjong?
I'm learning.
Yeah, that's the new thing. A lot of people are learning, and it really does help with brain health. Write your memoir or write notes to your children or grandchildren about different points in your life for them to have forever and for you to be using your brain. Join a movie club. Go once a week on Tuesdays, Senior Tuesdays. Movies are reduced costs on Tuesdays, or join a book club, or join a choir, or join a Bible study. There's so many different activities. I went fishing for the first time as an adult 2 summers ago with my sister and her husband and their kids. They've been going to this same lodge in Ely, Minnesota for like 42 years. So that was my first time going. Absolutely loved it. It was amazing. So the more new things you do, the more brain connections you're making. Okay. What about sleep? Sleep is one important part of improved brain health. So you should aim for 7 to 8 hours a night. If you have any sleep disorders, you should talk to your doctor about a sleep study. What do I mean by sleep disorders? If you are snoring at night, if you stop breathing at night, if you are waking up and walking in your sleep, and people are saying that you're walking while you're sleeping, if you're talking in your sleep, if you're getting up to eat while you're sleeping, these are all sleep disorders that people don't oftentimes pick up and diagnose until they get a sleep study. And then they're able to get treatment and then improve their overall sleep.
I have a question. What about a lot of extra sleep, like 10, 12 hours?
So that's something that definitely should be checked into also. Sometimes it might be something like the thyroid function is off, or you may have vitamin D deficiency that's off, or you might have abnormal calcium levels. So it may be time to talk to your doctor that I'm needing more sleep to feel rested. And that might be an opportunity to do some blood work. And if it's still nothing being unfolded, they may recommend a sleep study. Make sure that you spend time winding down before you go to bed with something called sleep hygiene. And I dare everybody on this call to Google sleep hygiene when we get off the call. Most people don't realize the habits that they need to adopt for better sleep. So these are just a few that I put down here, but you should limit your screen time before bed. So if you're on your phone before bed, or if you're watching TV, or if you're on the computer or iPad right before bed reading with the iPad, that light gives your brain the signal that it's time to be up. And it may be harder for you to get to sleep as a result of that. Consider adopting things like praying or meditating before you go to sleep, or limiting fluids so you're not getting up to urinate, avoiding heavy food 3 hours before bed. All of these are just a few of the recommendations for sleep hygiene. So everyone on the call, look up sleep hygiene on Google before the day is out, and just ask yourself, what can I change in my day-to-day sleep so I can get better habits?
I'm wondering, you said avoid heavy foods. How about a fruit as a snack, or fruit juice?
That's fine. That's a light snack before bed. And that's something that we often recommend to people who are diabetics, especially if they're on insulin, because they're at risk for their blood sugars dropping at night. Sometimes people just need a little meal so they won't feel hungry in the middle of the night. So a small snack like that is totally fine, but not a heavy meal. Okay. Daylight exposure is important, especially in Chicago in winters. We don't get enough daylight. So anything that you can do to expose yourself, a brisk walk during the day, or having a day light. You know, we have special lights you can get on Amazon for $30 in the winter, and just exposing yourself to maybe 15 minutes of that light a day can be helpful. Social engagement, we said, was one domain of brain health. So avoiding loneliness, because that can increase our risk for dementia. The less we interact with people, the more time we're spending not using our mouths to communicate. We're spending less time not moving if we're by ourselves. So all of that can help to accelerate dementia risk. So call a friend, join a group, go volunteer. Those are all things that we can do to increase social engagement. Laughter and conversation can stimulate the brain, but it also puts joy in our hearts. The Alzheimer's Association has a buddy up program that they recommend, to love your brain. And what that's all about is just partnering with friends, and family members and other active older adults to make sure that you have a buddy to do activities and socially engage. That helps to keep our brains healthy. What about stress management? We know that chronic stress shrinks the memory centers in the brain. And this is something that is particularly important to me as a geriatrician, because many patients I care for have frailty or dementia, which may limit their overall independence. So they oftentimes have what we call caregivers, family members who support their care. And that can be very stressful for someone, because oftentimes caregivers are still working, they're still maintaining their own households, they may even have children that they're raising while they're trying to help and support and caregive with a loved one. So you can imagine the amount of stress caregivers experience. So they are at risk for cognitive decline too. So it becomes really important to find different ways to reduce your stress in your day-to-day environment. And that can be anything from deep breathing to meditation to prayer, walking in nature, chair yoga, even music, anything that you come up with. That sit and be fit, I think, is a great way to incorporate stress management and even the Tai Chi, because Tai Chi helps you to focus and center in on your breathing. And you're so focused on that breathing and the motions that oftentimes it helps to quiet those inner voices of what is stressing you. Okay? So think about it. Talk to someone. Don't carry your burdens along. Whether it's a counselor or a family member or a psychiatrist or your religious or spiritual counselor, talk to someone. Do not bottle up things. Anyone want to comment on this? Because I can imagine all of you all have a dissertation you could give on stress reduction. Come on, I'm ready to learn.
I seek out people who have a sense of humor because laughter is really a good stress release.
Yes. It's medicine. I love that, Mary. Anyone else?
I just like walking. It just moves my body. And as my body goes, I can think through and take
Yeah.
care of whatever's happening.
Do you walk with music or without?
I just walk. Sometimes I just even count my steps and look around.
Yeah, yeah. Try it one day with music, and I highly recommend either Diana Krall or Jill Scott. Anyone else?
Also, sometimes just sitting and reading something that's just plain fun or looking at something that's really beautiful.
Yes, I like that idea. Do you go to the museum sometimes too, or? Yeah.
Yes.
How many of you have been to the new Obama presidential library, or at least to the grounds, like walk those grounds?
Not yet.
Yeah, that might be a nice walk, depending on where you live in Hyde Park. That might be a nice walk.
Oh, yeah, it's a great walk. But Hyde
Yeah,
Park is full of all kinds of museums, even going to
that's
the
true.
science and industry and just
Yes,
looking around and just
yes,
visiting the castle or watching the chicks come out of the eggs or God knows what.
yes. Yeah, I love that.
And there's a Smart Museum and the Hyde Park Art Museum. I mean, there's just a lot of stuff.
All right, so what's in the proof? The proof is in the pudding. So there is proof that brain health can limit dementia. We saw it with the Mind Diet, but this is a multi-center study that looked at whether or not brain health principles could actually reduce our risk for development of dementia. This study is called the US Pointer Study. It looked at whether or not lifestyle changes could protect cognition and reduce the risk for dementia in older adults. This study was a $50 million project over several years that was sponsored by the Alzheimer's Association to answer that question. Could lifestyle protect cognition and reduce the risk for older adults developing dementia? So who was in this study? They looked at 2,111 older adults between the age of 60 and 79. And they chose adults who were fairly sedentary. They weren't very active. They had less than an ideal diet. They had a family history of memory decline, either formal dementia diagnosis or their loved ones had observed memory declines. And then the individual had to have either hypertension or obesity. So definitely all of these risk factors for dementia, sedentary, poor diet, hypertension, obesity, and family history. So they had all these risk factors. They looked at these individuals over a 2-year period in the initial part of the study, and they set up 2 different groups of study groups. They looked at people in a structured group who were pretty stringent. These individuals were getting health assessments almost every week. They had to report what they were eating. They had to report how much exercise they were doing. They had to report how much they were sleeping, whereas they had a self-guided group. And in the self-guided group, they were given suggestions for different things they could do related to brain health, but they didn't have to follow a stringent mechanism and they didn't have to do a lot of health assessments and reporting. Okay, so it was like a do your own thing for the self-guided. The participants in the study were extremely diverse, and this was really important because this study had been conducted initially in Finland, and we know that Finland is not representative of the United States. So they wanted to do a diverse population. So greater than 30% of communities that are traditionally not represented in clinical studies were a part of this study. So that really tells us that this study is applicable to almost every group. Okay? Any questions so far?
No.
So what did we see as far as how the setup was? We had a structured versus a self-guided group. Okay. It was half and half. So roughly about 1,050 people to each group. And then these groups had to do 4 different areas of brain health. They had to either do some type of physical exercise, aerobic, resistance exercises, walking, stretching. They had to follow the MIND diet with an emphasis on berries, fish oil, and whole grains. They had to follow cognitive and social engagement practices like new brain activities of interest, everything from fishing to a music instrument to a language, and they had to participate in social connections. And then the 4th thing was focused on health monitoring. They had to do checkups for their blood pressure, their weight, cholesterol with a clinician. So the people in the structured group, as I said, had to do all of these things a certain number of times per day. They had to get health assessments once a week. They had to record almost everything and report everything. Whereas the self-guided group, do as you please. What did they find? They found that people in the structured and self-guided group, both groups improved in their overall brain health, and the structured group had greater gains as far as their brain health. The cognitive impact was a slowing of cognitive aging by about 1 to 2 years. So this study, just being able to do these 4 different activities, helped to prevent their risk for dementia by about 1 to 2 years. And then what they found was consistency was the most important thing. The cognitive benefits that they experienced were consistent across all ages, sexes, ethnicities, and genetic risk for dementia. So that means that everybody can benefit from doing these 4 things. So what did we learn today? We learned that the brain controls our thinking, emotions, mobility, and stress responses. We learned that brain health is accessible with daily habits that are practiced. We learned that our biggest threats to brain health can be decreased by just a few tweaks and changes that we can make today. And we learned that I, the individual, can personalize a plan to improve my brain health. So this plan right here is what I came up with for me. And I came up with this plan when I gave this lecture the first time, like 6 or 7 months ago. So I challenged myself to come up with SMART goals. I took all 6 different areas of brain health and I came up with a goal that I could achieve, and I put a numeric on it. How many times a week I was going to include that in my life. So the yoga 3 times a week, I'm at 2 times a week right now, but I've started incorporating Tai Chi, so I consider that goal met. Nutrition, decreasing chicken to 3 times a week. I don't eat beef or pork. I only eat chicken and seafood. So chicken has been a big part of the way I get protein for a long time, and I'm trying to decrease it and increase other proteins. So I'm actually pretty good with this one right now. The mental challenge stimulation. I chose learning Spanish online. I am failing horribly. Duolingo is just not meeting my day-to-day schedule. But I'm giving myself grace. Quality sleep. I try to get to bed before 10:30, but I only achieve it probably about 3 times a week. Most of the time it winds up being 11, but I generally get about 7.5 hours. Social engagement, join a ministry at church. I go to church. I still haven't joined a ministry. I'm going to work on it. And then stress management, 3 times a week, increase prayer and meditation. I'm doing it. I'm also doing deep breathing exercises too. So I want all of you all, I sent you a blank copy of this type of thing. And I want you to fill out what are some of the 6 goals you can come up with in your own life that we've discussed today. Might even be something that's not on the list of things that we talked about throughout the lecture, but that you can come up with on your own. So I want you to come up with your own brain health commitment. These are a few resources you can use. In the talk, I didn't mention Brain HQ and Luminosity. These are great resources if you want to do cognitive exercises online. The local programs like the Chicago Library System, the Y Senior Centers are great places for socialization and education. Do you see I shared this with the group at South Shore, Chicago Hyde Park Village? Share Network has great resources, and the Alzheimer's Association as well. Brainhealth.nia.nih.gov has all kinds of resources related to health too. I'm done. What questions do you have?
Oh, I'm thinking, I wanted to write down those resources. Could you put them in the chat, please?
Yes, ma'am.
Thank
What
you.
else?
And leave the chat
And
on
these
for a few
slides,
minutes after you leave.
these slides are going to come to you as well.
Okay, thank you.
And
Oh,
also, there'll be the recording of this whole session, right?
yes.
Yeah.
Yes. It is recorded.
Okay, I have just a couple of really specific little things, personal. For example, you say we shouldn't be looking at our computers before going to sleep, and yet I often will read on my computer until I'm ready to doze off, and it seems to work okay for me.
So everyone's different, but most people, because of the screen light, it can be very disturbing to their overall sleep. So that's why we generally recommend for people not to do it. But if it works for you, don't fix what isn't broken.
Well, if
Uh,
I'm reading and I reread a paragraph 3 times and finally, I decide, well, now was the time to shut it off. So,
Yes.
on the screen time, sometimes I like to just check my emails before I go to bed, and that's just 2 or 3 minutes. Does that make a difference, or is that okay?
think you have to ask yourself for your personal experience with it. If it is not bothersome to you and it makes you feel like I've checked the box and I've completed what I need to for the day, then do it. As long as it's not disturbing your sleep. The average individual, though, the light from the computer, from the phone, from the iPad can sometimes be a little bit disturbing of their onset of sleep.
What is
Thank you.
this brain headquarters or lumosity?
What did you say?
What is this brain headquarters or lumosity?
So this website, if you go on Google and you just put in luminosity, you can hear about the particular site, but you can also go to the App Store or Play Store on your phone and you can download it. I think Luminosity is a payment though. It is like a paid website.
I want to thank you. I think you did a great job. It was very comprehensive.
Thank you, Dolores.
Yeah, the only thing I was surprised that on the chronic stress, you didn't talk that much about news and the political environment because
Yeah.
especially over the 4th of July, just looking at all the different iterations of why we should be celebrating, and then all the things that, questions you raise in terms of how we got to where we are. So I think that different from people in the past that we're living through uh, something that can simulate chronic stress if we don't avoid the news. And then sometimes you want to talk to people in the social engagement, and what all they want to talk about are
Is
things that
yeah.
intensify your stress.
Yeah.
The war in Gaza, what's happening, a war in Iran,
Yeah.
what the Supreme Court has done. So we have to somehow change the narrative with them in
No,
terms of
I
what we
agree.
talk about. And I really like what somebody said in terms of the importance of a sense of humor and not letting these of what's happening politically steal your joy. And that's a real challenge. And the other thing I want to mention too, that sometimes people can over worry you about getting old. Oh my gosh, this is going to happen to you. This is inevitable. It's like you're in a death march or something. You have to tell them that you're managing your life with ease and and
Okay.
and
You got it,
you're
Eloise?
doing okay.
Got the check?
Okay, well,
Dolores,
that's all I had to say, but thank you.
Miss Dolores, I'm so glad this is being taped because I think what you just said in those last few moments is something that should be blast across the United States. Just the resilience that we as US citizens have to have right now,
Absolutely.
considering the climate we're in. And it is about finding that joy every single day
Finding the joy.
because you can't be consistently inundated with bad news and not have it in some way impact you. So I
Right.
love what you said about the humor, like Miss Mary said,
Yes.
and
Yeah.
and also the joy, like Miss Susan said, and really and truly just allowing yourself some grace. Yeah, I love it.
I want to
Love it.
thank the Chicago Hyde Park Village too for doing this.
I'm so glad I tuned in at the very end because what you just said and summarized really made
Oh,
my day. And
okay. Thanks, Carolyn.
Yes. Yes. Thank you, Miss Carolyn. Who else has comments?
I just think this is just wonderful. I totally enjoyed it. And I'm 86, so I'm working I'd like to live to be 100, so that's my big goal. But the other thing is this, my only problem is sleep. I sleep for a while and then I get up and I'll go do something and then I'll go back to sleep. And basically it seems to work.
If it works for you, don't fix what isn't broken. However, if you're curious to know why or make sure that everything's okay, I strongly suggest that you come in and see one of our geriatricians at South Shore Senior Center because sleep impairment is a geriatric syndrome, and we generally will sort of go through your history. We'll look at your medicines. We'll look at how you're doing with your bowel and bladder function. We'll look at how much mobility you're doing during the day, what your typical day looks like. And then we'll ask about, any snoring going on, any other issues, and we'll decide whether or not a sleep study is warranted. We'll also do some basic blood work, make sure all of your hormones are balanced. And if everything's okay and it's not broken and it's working for you, we'll leave it to that. But you can be reassured there's nothing that's imbalanced. So come on over. We've got appointments waiting for you.
What does a sleep study entail?
So a sleep study involves an overnight assessment of how you're doing with your breathing, how the electrical activity in your brain is working, and it sort of cycles through your different sleep cycles because we have roughly about 5 different cycles that we go through during the night of our sleep. And it spits out a report of how long you're staying in deep sleep, how long you're in light sleep, if it seems like your body's rested during your sleep cycles. And it'll tell us whether or not there's periods you stop breathing or periods when your body's moving when it should be still in your sleep. So it gives a lot of data about what is happening in your body when you're sleeping and if that's normal or abnormal.
Thanks.
What other questions do you guys have?
I just want to tell you, I thought this was great, and I really thank you.
Oh, thank you. I always enjoy doing these community talks, so I'm willing to come back anytime you guys invite me. Okay?
Yes.
Everyone have, oh, go ahead.
Yes, thank you. It's certainly been very helpful.
Thank you all. Have a wonderful and blessed rest of your day. And I'm going to steal everyone's comments. Don't lose your joy and don't lose your laughter.
Yeah.
Okay? That's going to be my statement for the day. I love it.
And
Thank you
transfer
all.
it to other people,
you.
like my husband.
Thank you, Dr. William. Thank you, everybody. Take
Thank
care,
you.
everyone.
Thank
Take
you.
care. Bye-bye.
Bye-bye.
Bye.